Hello, everyone. My name is Bruno Bastos. I'm a medical oncologist at Miami Cancer Institute. I'm pleased with this invitation to talk about disparities in GU cancer. GU cancer has a very high incidence and prevalence among the cancers. It's more common in men and women, more affected. And today, I think we're going to talk about a little bit the problem with disparities in this disease, which mainly involves prostate cancer, bladder cancer, urothelial cancer, testicular cancer. And we'll try to understand a little bit the issues related to the disparities in mortality, access to care, and patients' outcomes. So very briefly, I will try to share my screen to try to show it to you a few points that I want to share with you that I think would be relevant for a discussion today. So as you can see, this is my information. And as I mentioned, in GU cancer, we have mainly the bladder cancer, kidney cancer, prostate cancer, testicular cancer. We all understand this is an ongoing problem, and there are many, institutions and initiatives from across government organizations such as ASCO, ACS, and also from the academic and the community practice of oncologists trying to understand why this difference in equity care exists in GU cancers, as well as with many other cancer types. So we know this is an ongoing process, and basically, it involves, an understanding in a level of multiple spheres, not only in the biology level, but also in the socioeconomical level, to try to ameliorate this problem that exists. So I'll try to point out a little bit on each cancer type, recent observations that have been made and that I think would be interesting to discuss today, to try to further advance the progress in this field of ameliorating disparities in cancer care, particularly in GU. So for the bladder cancer, or urothelial cancer, this is a cancer that affects more men, in general, more white men, and it is heavily associated with smoking. So prevention is very important, to talk about smoking. So advocacy from many levels in the public health facilities and also physicians and society is important to alert to this. I always talk about the bladder cancer, the understanding of early symptoms, which mainly is blood in the urine, but also can be microscopic, is very important. And in talking about gender issues, it's very important to understand that many times, men, when they have blood in the urine, they tend to seek a medical consultation with a urologist quicker because it's not very common. Microscopic hematuria, it tends to occur more common in women. So sometimes this process of the diagnosis can be delayed, and we've seen this in clinical practice. So alert that blood in the urine always need to be investigated, even if it's considered to be a UTI or maybe related to menstrual period in women. It should be followed up to make sure that this is being taken care of, particularly if the patient has a history of smoking. So I always try to tell this in this information because it may have a major impact in the diagnosis. So I think prevention for this, it's very important, and across all population ways to reach out to the population for understand about the early diagnosis of bladder cancer, and prevention is very important, I think, to minimize, issues with disparities here. So, communication in their language, communication in the groups that the patients tend to go to, radio, TV, reading, journals from the community. That those are really important features that we need to understand. So understanding the biology is very important. One thing I want to mention really briefly that I think would be interesting in this disease, and they may understand a little bit about gender disparities, is that the role of the Y chromosome in this disease. There's new advances on this area, indicating that the Y chromosome may play a role and may make the disease more aggressive, which, may, if you lose that portion, maybe associated with more aggressive, but at the same time, it can respond better to immunotherapy when they develop. So all this understanding the biology is important, because maybe if there is a difference in the gender mortality, understand the biology may explain why this a difference exists, and ways to minimize that, and better approach can be developed. So in prostate cancer, we know that it's a very common cancer in men, and there is a historical disparity associated with African Americans with outcomes in this disease. So and that has led to many research in many spheres to understand access to care and prevention, very important, participation in clinical trials from all groups of the population. I think understanding tumor biology, genetics of the prostate cancer is very important. And this is ongoing. Prostate cancer, there's a lot of really research on this. I think is a fascinating disease to study across the population, because it really leads to better ways to create strategies. I think at this point right now, we're still unclear in which population should really push for prevention and diagnosis, but family history is very important. So I always tell my patients that, if you have a first-degree relative with prostate cancer, definitely, you need to talk to a urologist about it, age 40. Started to have a conversation about it. What can we do to minimize? And many times just a conversation, that is important to understand this disease and try to make early diagnosis. And in that moment, if we can do like a more like informed decision, should we treat now? Should we wait? If there was like a low risk, if they're intermediate, and the high risk, we can have a better strategy. So I think this conversation is very important. So, support groups, with patients to explain and talk about this disease is very important. And I think it has made a major advance in this disease. And, I think currently my main point for this prostate cancer is really prevention, I think. I think disparities, ameliorate disparities, outcomes here, in my mind, it would be mainly a pair of studies in prevention and also in tumor biology to better understand strategies, how to treat in a way that that equity in care could be achieved. For kidney cancer, this is a disease that, prevention, there is not much data on it. We always talk about it, that the majority of stage 1s and 2 and 3s that we see in the clinic are related to patients that have the cancer diagnosed in a way that, was not supposed to be for that issue, patient had a car accident and you found to have a renal mass, or go to the hospital for a gallstone and you find to have a renal mass. So I think studies in prevention in this disease is very important, because it would really try to understand and create some sort of equity in access to care and outcomes in this disease. And obviously, prevention, again, of the lifestyle risk factors. This disease is associated with smoke and also overweight, being obese. There is data on that. So, improvement, and talk to the population about eating healthy and having exercise is very important from all levels, and particularly in this disease. So all this is very important because, accessing good quality food, understand about nutrition and exercise, the importance of this, how to read labels in a supermarket with food, and understand the risk of cigarettes, all this, I think, in kidney cancer, those are the points that I'm highlighting here as major points that we think we should talk about it. In testicular cancer is a disease that we all know has a high cure rate. And when it's diagnosed, which is a good thing, and it's one of the major advances in oncology, chemotherapy is being the treatment of this disease. Historically, it has saved many lives. It involves young adults. It also peaks a little bit in late adulthood, but the young adults is the ones that we tend to see more frequently, and obviously is a shock for this patient population to have the diagnosis of cancer sometimes at such an early age. There is some sort of data arising also about Hispanics and in this population, which may be associated with increased mortality. So I think, for this disease, I kind of highlight a little bit of the importance of understand perhaps what is the main reason we are seeing this disease a little bit more frequent in Hispanics, and the biology. I do feel like this is my clinic too. I tend to see a little bit more happening, and maybe question, why is this happening? Is that something that we could learn from the biology and perhaps improve prevention on this disease, and also minimize this equity in mortality, minimize this difference in mortality and reach that equity, in this population. So I think, as I said, those were the main points that I want to mention today in our meeting. And I'll try to stop screen here in the Zoom, but I hope that you all have a good day. You learn about this, how to minimize disparities across cancer types. I'll be available for any questions and comments. I think there's a lot to reach in this. It's not easy because it involves many aspects of the healthcare, which is complex, we all know, and navigating through it can be really difficult. So participation from the government, the community, and the healthcare providers, physicians, nurses, nutritionists, nurse practitioners, it's surgeons, from all aspects of healthcare. Leadership is very important, and I am involved in many research projects on this, from the phase 1 experimental trials, which is also one of my specialties, until late phase 3 trials. I always pay attention to how to incorporate patients across all groups, race, ethnicity, gender, to reach to more equity data because in clinical trials, based the majority of the FDA-approved treatments we see out there are based on clinical trials. So having a diverse group of population that is representative of the diseases is very important, and that's something that is part of my research projects and interest. And it's something that I feel like we all should pay attention to it, regardless. It's a phase 1, phase 2, phase 3, having the understanding of that to proceed with better quality data that would help the population, in a way that would reach equity in care. Okay, so thank you very much, and I'll be available for any questions. Thank you.